dose interval between dose 1 and dose 2 for children should be altered, then we will do so. At the moment, the dose interval between dose 1 and dose 2 for 12 to 15-year-olds and 16 and 17-year-olds is 12 weeks. Overall, the priority is the booster program, particularly for older adults and those with underlying health conditions that put them at higher risk from COVID-19. The majority of people who are aged 50 years and above are already eligible for a booster. Some of those who are already eligible have not yet received their booster vaccination. I strongly urge everyone who is already eligible to please make the effort, book your appointment, and have the booster. That will be the best way to protect yourselves, your loved ones, and the wider society against any possible new variant wave of infection. Thank you.
Thank you, Wei Shen. So before we open for questions, I'd just like to kind of sum up a little bit. Today we've heard some very reassuring words from Dr. Rain about the safety of the booster programme as it is monitored in an ongoing way. And I think the three key themes we've heard in relation to Omicron and the JCVI advice are uncertainty, concern, and timing. An opportunity now to get the timing right. JCVI has today announced renewed urgency and further expansion of the UK booster programme. We don't know what's going to happen next. As I explained to you, the next 3 weeks are going to be weeks of scientific uncertainty. But whilst we wait for the mist to clear on what this concerning variant actually means, there is no time to delay. It's our opportunity to get ahead, and vaccine boosting is the thing we can do most easily whilst we wait for that science mist to clear. So to me, and as you know, I love football, we started with 11 players in the team with the Wuhan vaccine, and you could say that we've kind of picked up a couple of injuries when Alpha came along and then Delta came along, those variants that are slightly different from the Wuhan original strain. And we've had to use our subs off the bench to keep us in the game, but we're well in the game, and you can see that with the current epidemiology in relation to Delta, that the vaccines are holding up very well and largely keeping us out of trouble. Now, Omicron is like now picking up a couple of yellow cards to key players on top. We may be okay, but we're kind of starting to feel at risk that we might go down to 10 players. And if that happens, or if that's a risk that it's going to happen, then we need everyone on the pitch to up their game in the meantime. And that's really upping your game in terms of boosters and in terms of antibody responses. We're not going to wait for the red card to happen. We're going to act decisively now. And we're asking everyone to up their game. We're asking everyone to play their part in the urgency now of the booster programme coming forward the moment you are called by the NHS. It's really, frankly, never been more vital that the booster campaign has never been more vital than at this point in time. Thank you. I'm now going to open for questions, and the first question is from Jim Reid at the BBC.
Thanks very much indeed. This sounds like quite a significant, or a very significant extension of the booster programme. Can you tell us how confident you are that the NHS can deliver all these doses before Christmas, or are there going to be people that are just going to struggle to get these appointments before that festive break?
Yeah. So this is very new guidance indeed, as you'll understand, Jim. We've had to work at extreme pace, given the news coming out of South Africa being so recent. The NHS is now working through the updated guidance, and it's going to set out in the next few days how that's going to be operationalised. I would say it is undoubtedly a very complex phase in the NHS vaccination programme, because we've still got people coming for first doses, thankfully, second doses, as well as third doses for the immunocompromised, and boosters, and young people in schools. So there's a great deal going on. I think the important message that the NHS wanted me to convey to you today is that they understand the real urgency of this. They are up for the task, but they say that they will contact you when you need to act, and they will open the booking in a kind of orderly way, because one of the things we really don't want is people from the very youngest now eligible cohorts somehow getting in front of people who are at much higher risk of a bad outcome if they were to get COVID-19. Emily Morgan from ITV.
Thank you. You just asked people not to panic, but you're reducing the gap between the second dose and the booster from 5 months to 3 months. Isn't that a sign that you yourself are extremely worried about this variant and people will naturally panic?
So I'm going to allow Wei Shen to answer the question on the interval. But in terms of the kind of panic bit, I'm asking people not to panic, but I'm not asking them either to completely ignore the weather forecast. And, you know, we look at South Africa, it's our kind of weather forecast here, in the same way that, you know, the weather forecasters have warned us about Storm Arwen in the recent few days. You know, you can't ignore what you see around the world, and it is more urgent than ever before because of what's happened. But on the 3-month point, there's a very specific answer that Wei Shen should give you.
Thank you. In general, on immunological principles, the longer the duration between one dose and the next, particularly a booster dose, the better the effect. We know this not just from COVID-19 vaccines, but also other vaccines in other immunization programs. So where it is possible, it is usually advisable and beneficial to extend the duration between 2 vaccine doses, which is what we've tried to do from the very start. On the balance of that, we also need to be aware that, as I said, timing of a vaccine dose is important. We don't want to wait so long that a wave is upon us and we haven't delivered the booster dose either. So we need to strike a balance between waiting longer, but not waiting so long we miss the chance. In shortening the dose duration, we've chosen 3 months because there are data from the Cough Boost study, which is a trial that was carried out in the UK and is due to be published soon, that show that if you give a booster dose at about a 3-month interval from dose 2, one still sees a very strong boost response. A lot of the other trials have used a longer interval between dose 2 and the booster dose and show a very strong response. But this trial in the UK showed that very strong response even when the booster dose was given at 3 months. So we feel that it is reasonable to shorten the duration to 3 months, but no shorter than that, because that is where the evidence lies. We can give a booster dose at 3 months and expect a good response based on trial data. We don't want to go too early.
Thank you, Wei Shen. Tom Clark from Sky News.
Thanks. Given that people in younger age groups will be waiting 3 months for their booster jab, many of them, I imagine, won't maybe get a booster until Omicron, assuming it is more transmissible, makes its way here in large numbers. Did the JCVI consider whether it would be better to use those doses elsewhere in the world? I mean, taking your Premiership, your football analogy, you know, is it time the Premiership was a bit more generous to less fortunate leagues, less wealthy leagues, and share the vaccine around it? That is, after all, what these new variants are teaching us.
Do you want me to take that one? Yeah. So, look, on the point about global supply of vaccines, all public health people in the UK and around the world are very clear that none of us are safe until we're all safe. And we're very committed to the international supply of vaccines to all countries. So far, the UK has donated 30.6 million doses of the Oxford AstraZeneca vaccine, and already the scheduled-in commitments for 2022 amount to another 20 million doses of Oxford AstraZeneca and 20 million Janssen doses that were also ascribed to the UK. So this means, we'll have given half of our total order of AstraZeneca to countries in need. But we also have a responsibility to try to lock in and protect the gains we've made against this virus in the UK. And it's a difficult, hard balancing act. Chris Blythe.
Thank you. Just more broadly with the situation with Omicron in the UK, the Scottish Government said this morning they found cases with no history of travel. They've suggested community transmission is underway there. There are clearly dozens of suspected cases in England, suggesting perhaps there is some element of community transmission more widely. How concerned should we be about this, and what does it tell us about the potential increased transmissibility of this variant? And I suppose secondly, linked to that, even if it is more transmissible, and it already is here in large numbers, given how many Delta cases there are, it's probably going to be into the new year before it becomes dominant, even if it is as bad as feared. And therefore, is the hope that we can actually get the vast majority of those most at risk boosted before that wave that you talked about hits?
So it is important for us now, having the advance warning that we've had thanks to the South African authorities, to try and slow the ingress of a variant into the UK. And we do that because the science is uncertain at the moment about how the vaccines will hold up and the extent to which they will hold up. They're clearly going to hold up better based on the science with boosters, and we want to buy time to do that. So these are all interrelated points. And yes, the more boosting we can do by the time we have any significant amount of Omicron activity in the UK is going to be very, very important. How fast that will build up in the UK and to what extent it will build up in the UK is something we don't know. We're in uncharted territory. We do have already a highly vaccinated population, but not yet as fully a boosted population as we would like. There are many people still over the age of 50 who have not yet come forwards for a booster, and they are particularly at risk from a drifted variant without that booster. So that's really important. And I don't, like you, I don't have any concrete timelines at the moment, but I can say it's as urgent as it could possibly be. Nick McDermott at The Sun.
A quick question for Professor Lim. One of your colleagues described the decision JCVI has to make as slightly a bit of a Goldilocks moment. You've got to pick a kind of the right time, not too hot, not too cold. You explained your timings, but can you explain to the public, particularly younger people, why over the next few weeks they do need a booster? And I don't see any downsides in your plan, so why didn't we enact this sooner with Delta so prevalent? Why wait so late? For Dr. Rain, we've seen the EMA approve Pfizer 5 to 11-year-olds, but now it's been batted over, hopefully, to the MHRA. Would we expect a response from your team before Christmas? And then a quick one for Professor Van-Tam. You talked about the need for boosters and of a team effort to ramp up the numbers. The Sun's encouraging the Jabs Army to get together with 25,000 more volunteers to come forward. Is that the kind of action we need to see over the next few days if we're going to try and get ahead of Omicron?
Thank you. Wei Shen, would you like to start?
Yes, if I can start first. So thank you for asking about the younger adults. The current variant that's circulating is Delta, and the vaccine effectiveness against Delta is not as good as it was against Alpha. And that's because Delta is a variant which is slightly mismatched compared to the wild-type original virus that the vaccines were developed against. Nonetheless, the vaccine protection against severe disease in younger people, 18 to 39 years old, for Delta is extremely good. It's over 95% protection. Really, really very good vaccine. And at the 3-month mark, certainly even at the 5-month mark, that protection has not really waned very much against Delta. So if we were only dealing with a Delta variant, as we have been up till now, then we have confidence that we can keep going and not deploy the booster quite so soon, harnessing the advantage, as I said before, that a longer duration between doses is better. But that is not the situation we might be in should we have a wave of the new variant, particularly if the new variant is highly mismatched against vaccine. And so it is for that reason that we are now saying, let's not wait any further before opening the booster program to younger adults. Let's bring the younger adults into the booster program now so that any drop in vaccine protection that they might get will be mitigated by having the booster dose.
June.
Thank you. An application for use of the Pfizer vaccine in children aged 5 to 11 will be very, very carefully assessed, as you would expect, for safety, for effectiveness at the proposed dose, and for quality. And you ask if this will be concluded, this rigorous assessment, by Christmas. I would say very likely. And I say that because, as you'll be aware, we've allowed use of the vaccine for at-risk children since very early on, and we've collected a certain amount of safety data in this population. So in terms of time frame, very likely before Christmas, but we don't know until we've rigorously looked at all the data.
Nick, you very cleverly managed to get 3 questions into the same sentence, so well done. But your question to me was about the effort required now on the booster programme and about the Sun Jabs Army. So the specific details of how this will be operationalised in the NHS are for the NHS to announce in the next few days. But I do think back to the kind of the almost heady days of early 2021 when it was a true national effort, and we were very grateful to your army of volunteers for the help they gave. It is going to take that kind of spirit again to work with the same kind of enthusiasm and pace now to get us into the best possible position we can be in the weeks ahead. And the final question today comes from Hugo Guy at the Eye.
Professor Lim, the JCVI has acted very quickly to make this decision. You were asked to speed up your decision making, and it's less than a week since the Omicron variant came out. Why can you act so quickly now, and yet previously you've taken quite a long time to make decisions? For example, starting the booster campaign initially and rolling vaccines out to children. What do you say to critics who say that the JCVI acts too slowly until the moment when it's forced to speed up, like now? And can I ask, pregnant women have often felt confused and left out of the advice. Does all your advice, updated advice from today, apply equally to pregnant women, or is there anything specific they should be aware of?
Wisha.
Thank you. So maybe if I start with the second question first on pregnant women, because that's easier to answer. All the advice that we describe applies to pregnant women. As regards the speed of advice, there is a time to move quickly and there is a time to move more cautiously. You may remember that when the vaccine program was first launched last year, JCVI moved swiftly. Over the summer months, when we had time to move at the same pace as data were emerging, we felt that it was right to, if you will, shorten our stride so that we did not outpace the emerging data. And that meant that we could be as careful as possible given the circumstances. But when circumstances change and there's a need for swifter decision-making, then we will act more quickly. There will certainly be critics who will always argue one way or the other, that we're going either too fast or too slow at different times. But I would suggest that going quickly all the time isn't always the best, and going slowly all the time isn't always the best either. And we have to make some judgment as to when to go faster and when to go slower, given that there is always uncertainty in the evidence, and we're always trying to keep abreast of the data as much as possible.
Thank you, Wei Shen. So that concludes today's briefing. It is onwards and upwards with the antibody levels. That is the key task ahead of us now for adults in the UK. Thank you very much. This briefing is over.